Okay, so a lot of people ask how long should the cups be put on for? That's a great question. What you want to see is when you have these cups on, you want to see that skin get purple underneath. Hello, if you are someone that suffers from really tight muscles, really sore muscles, some people even would describe it like as fibromyalgia type pain where you just feel those really tender sore spots along the top of your shoulders, then this is a great video for you to watch. I'm going to explain how cupping can help you. Cupping at home can help you with this. So cupping, number one, it does a couple of things. Number one, it helps to increase circulation. So as you can imagine, if you have really sore muscles from working out, you can see why increasing circulation to those muscles would be helpful. So cupping does that. Cupping also encourages tissues to release toxins. So just to name a few, substance P, lactic acid. Lactic acid is when you've been using the muscles a lot, or it doesn't have to be from working out. It could be at work after a heavy, just a long day at work. If you have forward head posture like this, then you're overworking these muscles on the top of your shoulders, right? Without even realizing you're doing it. And cupping can be really helpful to release the toxins, which is cellular metabolic waste. And that leaves hormones and toxins like substance P and lactic acid. And this helps to release that from the tissues, and it helps to get rid of it through the lymphatic system. It just speeds up that process. It can also help reduce anxiety too. We've had a lot of patients say that. Another thing, it can help to reduce stretch marks and scars as well, small ones. So don't get your hopes up too much. If you have really bad scars, I recommend Fraxel laser for that. And then it can help with varicose veins and spider veins. But again, I think laser does a better job. We have cold lasers. Those do a better job of varicose veins and spider veins. But as far as trigger points, tenderness across the shoulders, the back, anywhere really, really tight muscles, cupping is great. And I want to show you this new cup that we have. There's a couple of ways to do cupping. Here you see he has some cups on him that I put right on the end of this, and I just pump this. And I'm able to pull the oxygen out of the cup. That's one way to do it. But now this company called Ached Away came out with a great cup, and you can do this at home, and you could just reach on the top of your shoulder and press this button right here in the middle, okay? And you'll see here, I'll put it on my arm so you can see. Now it's gotta be, the joint has to be bigger than the surface here. So just to give you an idea, you just press. And it's got an LED light to help reduce inflammation, and you can change the intensity. You hit M and it does a little more slow pull. You can do it 3 times. It's more intense. 4 is even more intense, and 5 would be the most intense. You can shut this LED light off if you want. It's got a lanyard here just in case, so you don't drop it. Okay, this is just a great cup to use at home, but we're not going to use it on me. We're going to use it on this guy right here. So he has some right shoulder pain, and this is his 3rd visit. This is the first time we're doing cupping on him. So we just hold the button down. And that's it. It should maintain its suction within a second or two. And then you just want to secure it. He's on his stomach, so we're going to just secure it to this here. And then I'm going to press 3, so we've got it on the 3rd strength for him. We're just going to leave it there. Now what this is going to do is help release some of the tension in the muscles in not only his lower back but his right shoulder. he had expressed on his first visit that he had some right shoulder pain.
Yeah, that's right.
Okay. And turned out his clavicle was just out by a couple millimeters. We corrected the clavicle, right?
Yes.
Were you sore at all after that?
No, it's so
No?
much better.
What's that?
It got so much better.
Great. So it got much better after that. We're going to check his shoulder again, and I'll show you guys that in a minute. All right? So this is cupping. This is the new cupper, it's called, by Ached Away. I think it's much easier to use than these, but it's also more expensive. This set, I got a whole set of like 20 of them, of these with the pump, down in Chinatown for, you can get them online for 20 bucks, no more than 20 bucks. The other type, you have to light a flame and put a flame inside. It's very hard to do that and then attach and put it on your skin right away. It's near impossible to do that on your own. This is about $149. I have a coupon code you guys can use. I'll leave it below. But a great tool to use at home. And then it shuts off automatically after 12 minutes. So, if you guys have any questions about cupping, comment below. Let me know if you have any questions at all. Cupping could be really helpful for those sore muscles in the back, in the neck. All right, stay tuned. We're gonna adjust his shoulder next. Okay, so a lot of people ask, how long should the cups be put on for? That's a great question. It really just depends. You see this one, this automatic cupper just did 12 minutes automatically. We just stopped filming. We didn't want to bore you with that part. But all you do is it stops automatically, and then you see it still stays on even after. But this lanyard's for safety, just in case, you know, you have it, you hold on to it with your hand, or if you fall asleep while you're sitting on the couch and it's up on your shoulder. But you just twist it and pull it off. And that's it. Really simple. Now, these cups have pins. You just pull it and it releases the air and you pull it off. Now, if you look here, this area is not as purple as this one or this one or this one. These are really purple. What you want to see is when you have these cups on, you want to see that skin get purple underneath. And once it starts doing that, that's how you know there's a lot of toxins that need to be released from the tissues. And that's a good sign. This one was less, so either tells me that that suction wasn't enough, or it's just not an area that has a lot of toxicity in the tissues. If we go a little bit higher up, you may see it get much worse, okay? But that gives you an idea of cupping, the benefits of cupping. After you have it done, a lot of times people feel relaxed. Their muscles, they describe it as they feel like their muscles are looser. Now, let's ask you a little bit about your lower back. How's that been? This is your third visit here, right?
It's getting better. Like my last visit it got so much better.
Good, okay, so.
I was able to sleep too.
Okay, so that second visit you made a real big turnaround.
Yeah.
Able to sleep. What about putting your shoes on? Has that been easier for you?
Yes.
Good.
Like, went to the bathroom, everything got better.
Okay. Yeah, he even had a difficult time using the bathroom, putting his shoes on, getting ready in the morning. Good thing. Are you working from home?
Yes.
That's a good thing he's working from home. He doesn't have to put his shoes on except to come here. But you can see here his pelvis is still out of alignment. It's still pulled up higher on this right side. So we need to correct that. Take some deep breaths in and out. So one way is to do cupping, but you notice I'm releasing the muscle right above where I cupped there. Cupping is one way to do it. I could have put a couple cups here on this right side as well. I just find that it helps to release toxins and helps with the soreness. But trigger point therapy and actual hands-on myofascial work works the best when it comes to relaxing the muscle completely. And his muscle's tight here. You feel that? A little sore?
Yes.
Take a deep breath in. Go all the way out. Good. So cupping is a great adjunct to the adjustment. I don't think a lot of chiropractors actually do cupping. It's very easy. I remember the first time I had it done, I was at a chiropractor's in Queens when I had it done. And afterwards I said, oh, you have to show me how to do that. I've never had that done to me before. Now, I had never been to a acupuncturist at that point.
That hurts.
Yeah, that's a sensitive spot there.
Yes.
Okay. Deep breath in and out. And that was 20 years ago. I've been doing cupping since. Good. Deep breath. Excellent. Just going to do a little cox flexion distraction here on him. This right here is going to help you put your shoes on a little bit easier in the morning. Maybe get out there tomorrow and play some soccer with your son.
That'd be great. We both appreciate that.
Yeah. Hopefully the fields will be dry. Right? I think we're getting some rain today, right? Soreness.
No.
Everything's good.
Yeah. Hurts way less than
the first time.
First time.
Yeah.
First time was a mess.
So it's for those of you watching this video. This is like a year, a little bit over a year into the pandemic, the COVID-19 pandemic, and some of you may be watching this years from now, but he's just appreciative to go out and play soccer with his kid. We really lost the summer in New York. Last summer we didn't really have it. We were all on lockdown. So we're just, everybody here in New York just appreciates those small things in life. Regardless of a pandemic, we're gonna have this side up. So you're gonna lay on this side. Regardless of a pandemic, we all wanna be able to play with our children, and we don't want our age to get in the way of that, or an injury for that matter. Bend this leg, straighten that one. Good. We're going to pull this one out. Okay. Yep. Okay. All right. Just take a deep breath in. Good. And blow all the way out. The other side up. And hopefully for some of you that are watching this in 6 months or a year from now, hopefully we won't have to be wearing masks anymore at that point either. We can get rid of those, right? Get back to normal. All right, good. Another deep breath in and just relax your waist and your back here and your pelvis. And again, deep breath in. Good. And on your stomach. No, on your belly. Okay. Center that down. Great. There we go. Now his pelvis is balanced. Okay. Do you sit at a desk, a computer desk all day?
All day.
All day, okay. You're not leaning to one side or anything like that, are you?
I hope not.
Okay. Did I give you one of my ergonomic cards?
No.
No?
No.
Okay. Today we're going to do that. It's a card, front and back. It shows you how to set up your computer, your workstation ergonomically, okay?
Okay.
Okay, turn over on your back. So I've done some ergonomic assessments for big companies, okay, and thousands of employees, and that's really overlooked a lot of times, just how you're working on your computer. So if your hands are up like this, that's going to contract these muscles up here, and you're going to have neck pain. If your chair is bad or it's too high, too low, that's going to create back problems. So certainly something you want to address, and sometimes you can address it for very, very cheap. Okay, and for you guys watching, if you have a laptop, that's not ergonomic. I don't care how you set it up, it's not ergonomic. You have to buy an extra keyboard and an extra mouse. That's the cheapest way to go, and then you could start setting it up ergonomically. Hopefully you have a desk and a proper chair too. And the chair is where it gets expensive. The desk and the chair is where it gets expensive. Cross your arms in front of you, almost. So we're going to do this before we adjust your shoulder, okay?
Okay.
Tuck your chin down. Come on up, have a sit up. Good. And relax. So he was really bent over, so I just corrected that. You okay? Almost feels like your back's going to break. But then afterwards you can take a deep breath, right? So that's right at the level of the diaphragm where the curve changes from lordosis to kyphosis. So when it's released, it feels great, and it also releases pressure in the lower back. A lot of people with really bad, severe back pain, they muscle guard in the middle. The muscles in the middle get really tight, and that's a way of guarding and preventing you from moving in a sudden movement with your lower back and injuring it. So the muscles adjacent to that area get super tight, and they guard. That's what was going on there.
Yeah, I believe so.
So we're going to check your shoulder here in just a second, that right shoulder. Yeah, your neck was subluxated too, where you have a bit of a stiff neck there.
Yes.
Yeah.
Every week.
Any headaches?
No.
Good. Okay, it was your clavicle, so we know what test to go to. Let's start with the strong side. So I'm going to pull out this way, then this way, and I want you to resist me. Palm out, lock your elbow. 1, 2, 3, resist. Good. 1, 2, 3, resist. Good. No pain, no discomfort.
A little bit here.
Okay.
A little bit.
And 1, 2, 3, resist. 1, 2, 3, resist. Any pain there?
No.
No, and that's the shoulder we fixed,
Yeah.
right? Okay, so let's have you stand up, face me. Okay. Are you having any problems in that right shoulder right now after I adjusted it?
Just a little bit when I extend my arm all the way to
Show
the
me.
top. Like here start hurting.
Okay, and
It
drop it
stops.
down again. So, folks, he just tested strong on that, stronger than the other side actually, but it's still a little bit higher. Why don't you face the camera here? You can see, okay, if you look at that, you can see the thumb on the right is a little bit higher. So that prevents him, so if the clavicle is higher over here, it's going to be lower down here. It's going to prevent him from raising his arm up. So we're going to correct that. What I'm going to have you do is lay down, and your right shoulder is going to go right on there.
This sideways.
Yeah. Actually, you know what? I'm going to do it without this. Make it easier. Lay on your side. Yep. Another reason why people's clavicles pop in and up is from sleeping on their shoulder, like this. Okay, and look that way. Yeah. Okay, and stand up. Okay, now go ahead and raise the arm. How's that?
It got better, but still.
It got better.
Yeah.
Okay. But still feeling it a little bit? Okay. Can you take another adjustment?
Yeah.
You sure?
Yeah.
Sit right here. So I'm showing you a few different ways to adjust the clavicle. We're going to, and just relax yourself here. That's not the best way for a medial clavicle. It is just for a superior clavicle, but he had superior and medial, so stand up. Okay, now go ahead and raise your arm all the way up. Okay, how's that? Just a second.
Still hurting the same area like this.
You feel it back there still?
Yeah.
Okay, lay back down on your stomach. So that is probably muscular, the feeling, the restriction he's having. I'm gonna have you, actually I'm just gonna pull your shirt up here. Yep. Right back here. Okay folks, so right now we have the cup on right at the junction where the supraspinatus, the infraspinatus, the teres major, the teres minor, all of those rotator cuff muscles come in to play and insert there. So we've just cupped over that area and we're gonna stop it early. It makes a noise like that usually when it ends, but we're gonna turn it off early, a couple minutes early. We're gonna twist it and pull it off. And that turned a little bit pink. You probably could have kept it on a little bit longer. Well, let's have you stand up and see how that motion is in that shoulder. Much better. So the restriction, a lot of the restriction was muscular, but also part of it was clavicular, the joint itself. But we still have work to do there. Okay, I'm going to give you some stretches that you can start doing, and you know, to help the process move along a little faster. Okay.
Okay.
All right, you're all set.
Appreciate it.
Thanks for tuning in, everyone.